World Population Day. It's my pleasure and honor to welcome each and every one of you for this occasion. I think we'll start the program by IMA prayer by Dr. Neelama. Dr. Neelama, over to you. Dr. Neelama, idira?
ಇಲ್ಲ ಮೇಡಮ್ ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಬೇಕು ಮೇಡಮ್.
Sorry, sir. Thank you. I am a prayer. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the detective beyond every greed and give. Jai Hind, long live IMA. Thank you, sir.
Thank you, madam, for the IMA prayer. Now I request Dr. Satyavati to do a flag salutation. Dr. Satyavati, over to you.
ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜಕ್ಕೆ ವಂದನೆ ಸಲ್ಲಿಸಲು ಇಲ್ಲಿ ನಿಂತಿದ್ದೇವೆ. ಅದರ ಗೌರವ ಮತ್ತು ವೈಭವವೇ ನಮ್ಮ ಬೆಳಕು ಮತ್ತು ಶಕ್ತಿ, ಮತ್ತು ಅದರ ಪಥವೇ ನಮ್ಮ ಪಥವು. ಈ ರಾಷ್ಟ್ರೀಯ ಸಂಸ್ಥೆಯ ಮಾನ್ಯತೆ ಪಡೆದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ಜವಾಬ್ದಾರಿಗಳನ್ನು ಅರಿಯುವ ಮೂಲಕ ಅದಕ್ಕೆ ನಮ್ಮ ನಿಷ್ಠೆಯನ್ನು ತೋರಿಸುವ ಪ್ರತಿಜ್ಞೆ ಮಾಡುತ್ತಿದ್ದೇವೆ. ದೇಶ ಸಮೂಹಗಳ ನಡುವೆ ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜವು ಉನ್ನತ ಮಟ್ಟದಲ್ಲಿ ಹಾರಾಡುವ ಸಲುವಾಗಿ ನಮ್ಮ ಅಧಿಕಾರದಲ್ಲಿರುವ ಎಲ್ಲವನ್ನು ಅದಕ್ಕೆ ಸಮರ್ಪಿಸುವ ಪ್ರಮಾಣ ಮಾಡುತ್ತಿದ್ದೇವೆ. ಜೈ ಹಿಂದ್, IMA ಚಿರಾಯುವಾಗಲಿ.
ವಂದನೆಗಳು ಡಾಕ್ಟರ್ ಸತ್ಯವತಿ. So now me, Dr. Padma Prakash, I'm the chairman of Ladies Wing IMA KSP. I wholeheartedly welcome Dr. Veerbhadraya sir. He is the president IMA KSP. Welcome, sir. I welcome Dr. Suri Raju. He is the honorary secretary IMA KSB. On behalf of Ladies Wing IMA KSB, I warmly welcome Dr. Lakkol sir, the past president of IMA KSB, and Dr. Chinivala sir, and all the state members of Ladies Wing, and the chairman and secretaries of other wings of IMA KSB. Thank you very much for joining us. And of all, the most important, the guest speaker of today, Dr. Chandrika. She is the Deputy Director, Family Welfare and Department of Health and Family Welfare, Government of Karnataka. On behalf of Ladies Wing of IMA KSB, warmly, I'm privileged to welcome you, ma'am, Dr. Chandrika, ma'am.
Thank you very much, ma'am.
Thank you so much for accepting our invitation in spite of your busy schedules. Thank you so much for joining. And all the senior doctors, Dr. Anuradha, Dr. Jayashree, and Dr. Neelama, all my team, Dr. Satyavati, and Dr. Chinivalar, madam, Dr. Jessie. So without wasting much time, now I request Dr. Veerbhadraya sir to address the gathering. Sir, over to you.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಡಾಕ್ಟರ್ ಚಂದ್ರಿಕಾರ್ ಅವರಿಗೆ ಸ್ವಾಗತವನ್ನ ಕೋರ್ತಾ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನ ನಡೆಸ್ಕೊಡ್ಬೇಕು ಅಂತ ಕೇಳ್ಕೊತೀನಿ. ಅವ್ರು ತುಂಬಾ ಚೆನ್ನಾಗಿ ಮಾತಾಡ್ತಾರೆ. ಜಾಸ್ತಿ ಸಮಯ ವೇಸ್ಟ್ ಮಾಡದೆ ಅವ್ರಿಗೆ ನಾನು ಇದು ಬಿಟ್ಕೊಡ್ತಾ ಇದ್ದೀನಿ. Thank you.
Thank you, sir, for your kind words. Now I request Dr. Suri Raju just to address the gathering. Dr. Suri Raju is the honorary secretary. I think is yet to join. Sir, without wasting, Dr. Suri Raju?
ಇಲ್ಲ ಕಾಣುತ್ತೆ ಮೇಡಮ್.
Okay, that's okay. So thank you so much, sir, for your kind words, Dr. Veerbhadraya sir. Now I think without wasting much time, we'll listen from Dr. Chandrika, ma'am. Over to you.
Thank you very much, ma'am. Thank you, Veerbhadraya sir. Thank you, Lakkol sir. And thank you for all the senior specialists who have joined this session. And I really welcome for this World Population Day. On behalf of this World Population Day 2026, with the theme of realizing the hopes and aspiration of young people today and for the future, as per the UNFPA's the theme which has been given, I'll be talking about this topic. Maybe why still the family planning are still we go with the name of Population Day, like, and what is its importance and why we are still giving more importance for this family planning and why that is required in a young people. So that's what we are going to discuss. And if any doubts or if any clarification is required, you can stop me at any level. Thank you. So with this theme, with everybody's permission, I will start my session. I have very few points to just share with you people. So I'll be telling a few indicators and the few the data which is available, and the global status and the country status and the Karnataka state in concern to the population. So why we have to focus on young people now, as per the theme for the World Population Day? As you all know, Karnataka is the 9th biggest state in India, having a population, high population. And of course, the India is now the number 1 in population. Previously, we say China is having the more population, was having more population, but now India has crossed the China population number and having a 147 crore population of India, and Karnataka having a 6.91 crores, nearly the projected population of Karnataka. And of course, India's this is the 9th largest state. And India is an adolescent now, if we say, among the population, almost 1 in 5 are in the youngest age group, are in the adolescent between 10 to 19 years. Maybe if you see the birth rate since last 10 years, it is in the declining mode. If you see the fertility rate, a woman giving a birth in her reproductive age, that is also in a declining state since last 10 to 15 years. But when we look into the age group population, the young population or the adolescent population is keep on adding every year. Maybe around 30 lakh, the adolescent group is added to the population. So India, it is an adolescent 10 to 19 years and the largest young generation in history, we can say. And about 6.1 lakh population eligible couples, so registered in the RCH portal. So actually what we observe the data is from the RCH portal. How many adolescents are eligible couple, we say, that is between 15 to 49 years. Any woman between 15 to 49 years, we call as eligible couples, married. So if we take that, it is really 6.01 lakh as per 25-26 data. And the habits in the young people, if we see, it is now the health behavior and life choices are made in adolescence. The shape outcome in the next. They now they are they're planning their health also. When health unlocks the education, see if the people, young people, they're the persons, if they're free of early or unplanned pregnancy, it is for more likely to complete their school and the teen colleges and all. And as you would have already seen in newspapers and in medias, that many of the teenage pregnancies are being reported. In the hostel, many of the girls, they are delivered, they're delivering and they're leaving the child in a bathroom and they're just going out. So even if we take an indicator like the teenage pregnancy indicator, it is of course the 4.9% of the pregnancy is in a teenage group. So how does it matter? How does it affect the health? Is like if one woman, if or a girl, if she become pregnant, then definitely her education and all her other life will be spoiled. So this health definitely it unlocks the education. And when we speak about the demographic dividend, so Karnataka's growth, it depends on a healthy, skilled young workforce. So reproductive health is, of course, it's a foundation. Previously we used to speak after 15 years only the girls will mature or they start menstruation, menarche will start. But recently we are observing even the 10 years, 11 years girls are menstruating. Maybe it is a hormonal or maybe lifestyle or environmental. So we have a different reasons for that. So what young people, they hope for, what they are really require or they are expecting. So now, as the present situation, if we analyze, they are asking for a education, completion of the education. They want to have a good education, higher studies, and they don't want to just enter into the married life or like that. And the career and financial independence, they want to be financially independent and they want to earn, they want to build their career like that. And the healthy relationship and unplanned families. So the marriage is built on equality. Maybe even both the male and the girl child, male and the girl children, they are expecting the equality and more respect and more independent life, and they like they want to earn more and they want to even earn the knowledge, gain the knowledge. They want to participate in all the aspects. Uh, and other thing is like they want to delay the pregnancy also, and they are understanding that parenthood or the pregnancy is just by choice and it should not be by chance. So they speak, but though all these things are there, but our youngsters, they don't speak about the contraception, they don't speak about the family planning, they speak more about their classroom things, and they speak more about they do gossips, they speak about the careers, they speak about the relationships and their preparedness, about their family, their everything they speak. But they don't want to discuss or they don't want to speak about the contraception or about the family planning. So that is the drawback here, where still we are observing the teenage pregnancy or the girls landing up in an unintended pregnancy. And later on, she is losing her education and her careers also. How this family planning makes this whatever they dream is possible is like preventing the unintended pregnancy by knowing or by understanding the importance of contraceptions, the use of contraceptions, by adopting the family planning methods, and to understand or to learn more about the sexual uh, education and also about the reproductive health. If they learn more about these things, definitely I feel they can achieve whatever they are dreaming about. And they should think, even though they are married, I mean, they marry at a right age, maybe after 18 years. And even if they plan their first pregnancy after 20 years, they should understand about the healthy spacing between the pregnancy. One thing, all the teenagers should understand that what is the right age for the marriage and what is the right age for the pregnancy, and why this family planning or contraceptions are to be used to keep a good reproductive health and the sexual health, mental health. I can say definitely without any stress or without any hesitance, they can lead their life if they adopt the family planning, because they will not be having an apprehension of getting an unintended pregnancy. So definitely they will be free from all these this maybe they feel like maybe some anytime they can become pregnant, so that kind of apprehension will not be there. So to keep their life more stress free and without any apprehension, if they can lead their or they can have their sexual life by using contraceptions. And they also should understand the family planning and the contraceptives will definitely reduce the maternal and the infant mortality and the morbidity. Where if any woman or any girl, if she becomes pregnant in her early age, and she completes her family, maybe 2 or 3 or 4, whatever the children she wants, and within some 20 years or 25 years, and she would have gone for sterilization also and completed her adopted her permanent method of contraception also. And after that, what? So by the 25 years, within that, she would have all completed her reproductive life, her sexual life, and later on what? So after 25 years, she will be having more life to enjoy. So these people's, without thinking about the contraception or without knowing about the contraception, the knowledge about the contraception, they are losing. I feel they're losing their happy or stress-free sexual or the reproductive life. So maybe even if anybody, if orientation is given adolescent to the adolescents about the contraception or about the family planning or about the sexual activity or the sexual education is given properly in the teenagers, maybe they will plan their life, maybe when to become pregnant or when to marry or when the first child has to happen and when she can have the second, third or whatever the child. And without any unintended pregnancy, she can lead her happy life. If we see the current situation of Karnataka, there is, as I said, it is 4.9% teenage pregnancy still we are observing in Karnataka. And adolescent fertility rate, when the girls between 15 to 19 years who are delivering live or giving births to the live children, that is around 40, nearly 40 per thousand deliveries, we can say. But when we look into the contraceptive acceptance rate, it is 63.2%. So it actually goes hand in hand. Whenever there is an increase in the acceptance of contraception, modern contraceptions, definitely there will be a decrease in an unintended pregnancy. And maybe we can expect the zero or a very minimal teenage pregnancy. And of course, the unmet need, we can reduce it. So we have, you all know about the contraception. I don't have to explain about all the methods, but still I take a chance to just give a small introduction about the contraception, methods which are available in the basket of choice in the family planning program, the National Family Planning Program, which is giving a free supply and making availability of this contraception in all the healthcare facilities. And also it is supplied by ASHAs to the beneficiaries at their doorsteps. So we have a short-acting contraceptions like condoms, Mala N, which is an hormonal combined oral contraceptive, having levonorgestrel and the progesterone tablet. And we have a Chaya tablet, that is a non-hormonal weekly pill, we can say. And we have a long-acting contraceptions, reversible contraceptive, like intrauterine copper devices, maybe which may be inserted in the interval period during menstruation. And it can be inserted even following the delivery, that is postpartum, and even soon after the abortions, like post-abortal. And as you all know, we have two kinds of copper teas, that is 375 and 380A, which are freely available in all the hospitals and which are more accepted by Karnataka beneficiaries also. And we have other long-acting reversible contraceptives like injection Antara, that is depot-medroxyprogesterone acetate, which is available both in intramuscular dose and also in subcutaneous route. So this subcutaneous route they have introduced to make it available for a self-injection. But right now in Karnataka, we have not yet started or introduced, or we are following that self-injection of subcutaneous Antara. Still, we have a practice of the service provision by the service providers, both intramuscular and injection Antara, which is given 3 monthly once and can be taken up to the maximum dose of even 20 doses may be taken. Of course, the myths are there. I say myths are more with the service providers rather with the beneficiaries because they are only not ready to accept the effects of the medroxyprogesterone acetate, which is like amenorrhea or a scanty bleeding or maybe an irregular menstruation. But the most effect of this medroxyprogesterone acetate, as everybody knows, is that amenorrhea, we can say. And the one more contraceptive is there, very new contraceptive, which is introduced in Karnataka since last 2023, since last 3 years. That is implant, Nexplanon, we can say, and that is subdermal single rod implant, which contains etonogestrel 68 milligram, and which is placed underneath the skin, that is in the subdermal area, on the inner aspect of the upper arm in a non-dominant hand. So that is like a matchstick, almost similar to the plastic matchstick with the 4 centimeter length and 2 millimeter diameter. It gives a protection for 3 years. So now we have introduced this contraception in 17 districts in major hospitals, like only in the district level and the taluka level, bigger taluka level hospitals. The other method, like permanent method, we have that is female sterilization and male sterilization. Of course, in Karnataka and even India, I can say the male participation for family planning, of course, is very less, very minimal, I can say. Maybe we can make them understand what is the importance of male participation in family planning. So if that is accepted, then definitely still more mortality and morbidity of the mother or the woman can be reduced. We should make, to give a provision of services, contraceptive services or the family planning services. I think counseling and informed choice is very much required by a trained counselor or even any person in the healthcare facility. Maybe a staff nurse, maybe a doctor, or maybe PHCO or the CHO, whatever, whoever is there in a healthcare government facilities or even in a private hospital, a staff nurse or a doctor or even the PRO, whoever is more trained person for the counseling. So they can counsel the beneficiary for accepting any kind of contraception which they like. But we have to give an orientation regarding the methods available, and for that for their health or for their situation or for their the timing, what kind of contraception can be accepted by them, that can be counseled by a trained counselor. And if we keep our privacy, that's one more very important aspect where even the healthcare providers, they forget to keep the privacy of anybody's women's or men's contraception or the family planning, the service which they have taken. So the confidentiality or the privacy, if it is protected, then definitely any person can accept, and any person will blindly will I mean, accept whatever the service provider will say, or the healthcare service providers will say. And it should be youth-friendly design. Like we have a Sneha clinics or RKSK adolescent clinics, like where the adolescents are educated about the menstrual health, or about the contraception, or about the sexual education, or about the reproductive life and all. So we have to give them up the knowledge about this kind of services available. And it should be free and freely available and freely accessible to the beneficiaries, I can say. So if that is there, then definitely the acceptance will be more. As I said, this acceptance for the enhancement, or to ensure the availability and availability and this making availability of the contraceptions, like short-acting contraception, the condoms, emergency contraceptive pill, or even to confirm whether they're pregnant or not, pregnancy test kit. So we have introduced and installed self-care kits. It's like having the 3 columns. So you would have seen the Nirod boxes. It is almost similar to a Nirod box, but it is having a 3 columns where condoms are there, and emergency contraceptives will be there, and along with this pregnancy test kits. So any person can come and pick anything from that, and they can use it. And how to use, what is there in that and all will be available in the QR code. If they scan the QR code, so all the information will be made available. It is made available in this. Then, of course, we have with the Amicus Foundation, we have developed an SOP, standard operating procedure, for managing or for supporting for a teenage pregnancy, maybe following the sexual assault, or intentionally or unintentionally, if any pregnancies happened in adolescent or in the teenage groups, then what has to be done, and where it has to be reported, what kind of service we can give, and where she has to go. So everything is explained in the SOP, which will be notified very soon. Maybe within 1 week it will be notified from the government. And of course, as I said, IEC, BCC, which is more important, and we have to give awareness about the teenage pregnancy outcomes, the risk in the teenage pregnancy, and the drawbacks with the teenage pregnancies. Of course, multi-department involvement is very much required. I request, especially I request all the private hospital and the private practitioners for this, because most of the time we see the importance or the service for the contraception in the private facilities. It is somehow it will be like it is not like demanding kind. We don't ask. Maybe if at all, if they ask, they might give, but the promoting for the contraception is comparatively less with the private practitioners. So it is not a negative comment. I'm sorry. I request all the private practitioners also, and all other association also, to promote for contraceptions and the family planning services. How we can reach the young people is definitely through the digital and the social media, of course, which is more popularizing nowadays. So this kind of reels we can do. That is being done from the government also, and we have developed a few videos, and we have developed a few story kind of things, and radio jingles and all. We have developed about the contraceptions, and about the teenage pregnancies, and about the abortion services which is available. And also we have some IEC, BCC campaigns. We celebrate this kind of World Population Day. And we have a peer educators, that adolescent counselors from the RKSK program, where they give a knowledge about the sexual education, the reproductive health, the contraceptions, and the family planning. And of course, the ANM, who really are the boon for our department, who are supporting for distribution and for promoting the contraception services also. So of course, we have reached the total fertility rate. I mean, the replacement level of the fertility rate. Still, for the healthy timing and healthy spacing of the pregnancy, to have a good maternal health and the infant or the child health, the quality of the services also to be improved, so that we are taking care. And this contraception should be a right of a person, just like any other health right, right to have a contraception, and right to live, like right for any other rights, just like any other rights. This contraception also should be a right of all the eligible beneficiary, I can say, even including the adolescent and all others. Of course, the PPI UCD acceptance, I was telling, that has also increased. And now about the implant, we are promoting more, though it is made available in the district level hospitals and the taluka level hospitals. So anybody can uh, get this service at the district level or at the taluka level hospitals uh, at free of cost. For that, the demand generation is happening, and till now, since last 2.5 years, we have implanted around 11,000 plus implants. And of course, the removal rate is also there, around 4 to 5%, maybe because of they want to have a child or they want to become pregnant, and sometimes they without any reasons they just want to get it removed, because with the myths and with the negative the hearings from the neighbors or friends, sometimes without any reasons also they are coming for removal. So that is around 4 to 5%. But as a whole, acceptance for the implant is very good in Karnataka state, and I can proudly say this is Karnataka is the first state, #1 state in implant acceptance by the beneficiaries. And I just wanted to give one small information regarding the abortions which are legalized in India. So the free abortion services, comprehensive abortion care services, which are made available at all government health facilities. And about the MTP Amendment Act, we have oriented even the private, the gynecologist and the private clinicians also. But still there is some gap in knowing about the comprehensive abortion services. And still we are seeing some illegal abortions being happening for some unintended pregnancies. So we are working for controlling this unintended pregnancies, and also to provide to increase the provision of abortion services, safe abortion services, and early identification of the pregnancy. And if at all, if she don't want to continue, to give abortion services at the earliest to her. And after the abortion services, we are promoting for a post-abortion contraception to keep at least a minimum spacing of 6 months following any abortions. As you all know, the fertility will regain soon after the abortion, within 12 to 14 days. And of course, following the delivery within 42 days, or just following 42 days, the fertility will regain. So we are more promoting for a post-abortal and post-partal contraception, for increasing the spacing between the pregnancy, to keep, to give good maternal health, to prevent mortality and morbidity. in a woman and also in a child. Uh, uh, from this, from my side, just a small presentation from regarding this theme about the World Population Day. And if any mistakes are there, please, if any clarification is required, please raise it. If I know, I'll definitely answer. I'm not a gynecologist, of course. About the program, what we are doing, so that I have explained. I request even the pediatricians also, because I always say to the pediatricians, they will be examining the child, or they will be treating the child of a mother having children's, like one will be standing about 4 5 years 6 years, like, and other the smaller one will be standing near to her, and one will be in her shoulder, and the one will be in her womb. So more maybe like that, 3 4 5, like that. And I have seen a woman admitted her child, the first child, in an NRC for a severe some malnourishment, and having one more child that is also severely malnourished, which is there in her house. I mean, at her home, she would have left, because it maybe it is not in such condition to admit, and one more child in her womb. So this is what even everybody will be observing, even the pediatricians. So if such situations, if you notice such situations, please advise her about her reproductive life and her family planning. Please insist her or ask her to go for some contraception method, so that she can postpone her next pregnancy, if at all, if she is not pregnant. And if that is an unintended pregnancy, and if she don't want to continue the pregnancy, and if that pregnancy is continued, if you feel that health of the mother will be affected, then please advise her to go and take a service of for abortion, so which is legalized, and that is freely available in all government facilities. Thank you very much.
Thank you very much, Dr. Chandrika ma'am, for your statistical talk. Very interesting, and that is a ground reality of the Indian population. Any questions from the audience? Dr. Veena Bhatt says, Namaste, Dr. Chandrika ma'am. Very simple way you are guiding us about the government facilities being available for the practitioners. Thank you very much for reminding our responsibilities.
Thank you very much, ma'am.
Thank you, Dr. Veena Bhatt. I think one more message is there.
Madam, good evening. I'm Dr. Indira, Dr. Padma. And
Hello, Dr.
hello.
Hello,
And
ma'am.
hello, Chandrika madam. So, and can I speak 1 or 2 minutes?
Please, go ahead, go ahead.
Because I'm very thankful, Chandrika madam, your insightful presentation. And I really congratulate the IMA Karnataka State Branch and as well as the ladies wing, because I'm also a member of the Elanka, and most of the time I could not able to join you people. But when I saw there is a webinar, and that to my friend Dr. Chandrika madam is presenting, I thought of joining. It is my favorite subject too. And for organizing the webinar on the occasion of the International Population Day is very excellent with the theme. What madam she said, almost she covered her topic as well. Correct? Am I right, Dr. Chandrika madam?
Hope so, ma'am. I don't have to tell.
But as I'm also a member, and as well as with connected to my nutritional part, I would like to emphasize that realizing the hopes and the aspiration of these young people begins with investing in their health and the nutrition, right? The adolescent, it is a critical window for the opportunity, and very well nourished adolescent is more likely to perform better in education, develop skills, and to contribute productively to society, and they can make informed decision about their future life. So when it comes to the family welfare and the reproductive health, they are very important pillars as well. In the nutrition also is equally vital role. As a since last 1.5 years, I am into the nutritional aspect, and as you said well, that he has recently I visited Koppala also, the district hospital, to visit my NRC, Nutritional Rehabilitation Center at the district hospital. And unfortunately or fortunately, because we all are linked together, one is family welfare department, family or FW services and maternal health services and child health services, and even immunization and as well as the nutrition. When I started asking that poor chap what she said, it is her, the child is very acute SAMS children and with very sick. And finally, as this is a fourth child, she said, then I said, at least why you did not take further any contraceptive or anything or any knowledge about the spacing for the, she doesn't know anything. And meantime, I said, at least now, at least you are in the hospital, you can take the counseling. And I asked RCH officer also to please educate her and at least she can adopt some of the contraceptive methods. Then she's saying, I'm now already 4 months pregnant. How finally what to do? One small child which is very sick, it is there in her lap, and again she's pregnant, and she is also she's a malnourished lady. Then think about where we do stand. And the next bed I went, the same scenario. So like that, almost 5 beds were almost same scenario, and it is very pathetic. And we need to again, I ask this forum also to educate because the patients they may come to either government or the private sector. Definitely, the one is family welfare and the reproductive health is very important. Along with that, the nutrition, because we need to emphasize on the children how they grow up. Getting the pregnant and parallelly going with the unhealthy child is very pathetic condition. And one more important, I want to emphasize on this forum because Madam was saying in the theme also regarding the adolescents. Anemia being among adolescents and especially the girls, that continues to be a significant public health challenge. And preventing this anemia and promoting healthy diets and encouraging physical activity and ensuring mental well-being should also go in hand with the reproductive health education. A healthy adolescent today, it becomes a healthy parent tomorrow, which will contribute to the healthier families and the healthier nation as well. Because the convergence between the nutrition, family welfare, school health, adolescent health program is very essential to achieve our whatever we have going with the goal of empowering the young people. And maybe the population stabilization is not only about the family planning, it is also about the building a generation of healthy and educated, very well nourished and empowered young people who can realize their future full potential, what they should be the decision making. This is what I thought of just contributing to Dr. Chandrika madam. Maybe it is going to help to think along with the family planning and the reproductive health. That's it. I just wanted to share. Thank you so much for giving the opportunity to just give my some few inputs about this on this International Population Day. Thank you.
Thank you, Dr. Chandrika, for the inputs. I think one more
Thank you,
question
ma'am.
from
Thank
Dr. Vijaya. Namaste, how long the implant works once placed? Contraceptive implant.
It is 3 years, ma'am. 3 years.
3 years.
From
Dr. Vijaya, I
insertion
think
to
it's
3
3
years.
Okay, okay, ma'am.
Thank
Any
you,
other
madam, for
questions?
nice presentation. There are two contraries. There are a group of people, they say DINK, double income, no kids, and the other way will have more kids. So we have to educate both of them. This double income, no kids, they fall into infertility or so. So we have to educate them also, and the persons with many kids also we have to educate. This is two contraries in this day of World Population Day. So what's your
Definitely,
opinion
sir.
about this? Yeah.
Definitely, sir. This is the situation. And we have different kinds of the woman in a different age where they really require. In all age group, in all situation, knowing about the contraception, knowing about the family planning, adopting the contraceptive methods and the family planning method is very important. Maybe she's adolescent, but she should know because she might get into the sexual activity and she is in a danger of becoming pregnant, maybe married or unmarried. maybe she will become pregnant or maybe she will not become pregnant. And the next, maybe during the pregnancy also, we have to advise her about the contraception. Whether they are rich or whether they are poor, it doesn't matter. Well, infertility, of course, it can happen anytime. Even we have noticed the infertility even in a a girl married, like ಬಾಲ್ಯ ವಿವಾಹ ಮಾಡ್ಕೊಂಡಿರ್ಬೋದು ಅಥವಾ ಅರ್ಲಿ ಚೈಲ್ಡ್ ಮ್ಯಾರೇಜಸ್ ಅಲ್ಲಿ ಆಗಿರಬಹುದು. ಅಲ್ಲಿ ಕೂಡ ಇನ್ಫರ್ಟಿಲಿಟಿ ವಿ ಹ್ಯಾವ್ ಸೀನ್, and we have seen the woman married in a right age and she's in her proper sexual life. There also we have seen an infertility. And in a young girl marriage, after marriage also we have seen before 18 years only she has completed 2 to 3 children, having the 2 to 3 children, and she has completed, I mean, she has her 2 or 3 children within 18 years of her age. And we have seen even 35 years of a woman not having a child. So it is like the contraception is, the knowledge about the contraception is very much required. And we have to give our awareness and services to both and to all kind of people, pregnant, postpartum, post-abortal, and married, unmarried, and having completed their family. Maybe they would have undergone permanent method of sterilization, maybe when they are in a primary infertility, or maybe they are in a secondary infertility. So whatever the kind, this is very important, I feel, sir. Thank you, sir.
Ma'am, actually here we say that World Population Day, we are one in the world out of 800 crores. We are 148 crores. We stand almost 18% of the world population. But how it is about talking about contraception, because the fertility rate it's coming down from 2.1 to 1.7 or 1.9 it is. So we say it, as Veerbhadra sir was saying, it is really like, one side we say fertility rate is going down, where we have to increase our population. At the opposite side, we are saying population is more in India, and we talk about contraception. How do you justify this?
Definitely, ma'am. Ma'am, contraception now, right now, what is there? The family planning or the program itself is not running to control the population. As you said, definitely the TFR is below the replacement level. But why we are promoting this contraception? Why any woman should have the contraception knowledge and should accept the family planning is, one is to avoid the unintended pregnancy now. So that is the what we can say alarming, or it is dangerous, we can say. Any woman should not be having her life with stress that she may become pregnant anytime. Anytime she can become pregnant when she is married and if she is leading her life. So that stress relief should be there for any woman, whether she is a working or if she is a non-working woman also. And any teenage or adolescents, nowadays we are observing the living together relationship and the friendly environment, and all girls and the women, they are in all kind of the what we call the field. In every field they are there. So maybe whether married or unmarried, they will be under a risk of becoming pregnant. So first thing is to avoid the unintended pregnancy. Second thing is to keep a spacing between the children's. And the third thing is to avoid the early pregnancies, like before 20 years of her age. And maybe in a very few pockets of Karnataka, we still have the multiple pregnancies, like more than, as sir was telling, even the poor or any woman having more than 3 children or 4 children, like that. Still we are observing the 5th gravida, the 6th gravida. Still we are reporting with a 10th gravida. So that the multiple pregnancy has to be avoided. So the major areas where we want to address with the family planning to provide a good maternal health and good, child health. So for that, this family planning and contraception is very much required.
Thank you so much, ma'am. One more question from Dr. Rajendra Prasad. How to handle unwanted pregnancy in a minor girl? Sir, will you just read out your question, sir? I'm unable to see. Dr. Rajendra Prasad.
If it were to be advanced pregnancy, madam.
How to handle
and advanced.
unwanted pregnancy of a minor girl
And advanced pregnancy.
and advanced pregnancy. Chandrika, ma'am, over to you. How to handle an unwanted pregnancy of the minor girl if it is an advanced pregnancy?
Sorry, sir, please repeat, sir.
How to handle unwanted pregnancy of a minor girl if it is in the advanced, if it is an advanced pregnancy? Minor girl
Yes,
pregnancy.
yes, ma'am. As per the MTP amendment, till 24 weeks of the pregnancy, the minor or the sexual assault survivors, we can give us legalized abortion services, the safe legalized abortion services. Up to 20 weeks with one doctor opinion, and between 20 to 24 weeks with a two doctors opinion. After 24 weeks, if it is a minor, if any congenital anomalies are there, any substantial congenital anomalies are found in a fetus, then that should be referred to a medical board, which are placed at the district level facilities, district level hospitals. So there we have constituted a medical board with the chairmanship of a senior gynecologist and a pediatrician, radiologist, anesthetist will be there. So they can give an opinion regarding the abortion services directly if there is any substantial congenital fetal anomalies. If there is no anomaly, then the case has to be referred to the judicial services. So from the court, the beneficiary has to get the opinion. And court will ask the medical board only to give an opinion whether the abortion can be done to that girl or a woman. So with the court opinion and as per the medical board opinion given to the court can give an opinion whether the abortion can be done or what. I was telling about the SOP which we have designed for a management of the sexual assault survivors for the pregnancies following the sexual assault survivor or even the teenage pregnancies also. What we can do for the child if it is born live following an abortion in case of a minor or in case of a sexual assault survivor, even if it is an unintended pregnancy in any age group. For that, we have brought this SOP. As I said, that will be notified within 1 week from the government side, and that will be circulated to all. I think, hope I'm clear, sir.
No, madam, there are two contradicting things. One is
Yes, sir.
POSCO case, and another thing is below 18 years, she cannot give consent. How to, it is contradicting. The law itself is contradicting at a different time.
For abortion services, definitely if she is below 18, the parent should give a consent. Or if any attender is there, if any person from the child protection department, if somebody has assigned for the caregiving, so then that person can give a consent for abortion with the consent of the girl. Her words will also matter, sir. Her decisions, like, and in case of a minors following a sexual assault, of course, any minor pregnancy will be considered under POCSO, if married or unmarried. For married, of course, if the child is born, if she wants to have a child, the pregnancy services will be given and the management will be similar to the high-risk pregnancy. And following the delivery, the child will be taken care by the parents itself. But whatever the POCSO Act says, like the accused will be under the custody of the judicial custody, and the girl will be under the care of her parents. So that will be there. If she is unmarried, then the case will differ, but the consent for the abortion services should be given by her parents if she is less than 18 years, and the abortion services has to be given if they are willing for that. If they don't want to go for an abortion, then she has all rights to continue the pregnancy. But up to 24 weeks, as I said, up to 20 weeks, one doctor can give an opinion for abortion and do this, give a service of abortion. And if it is 20 to 24 weeks, two doctors' opinion. About 24 weeks, if there is no congenital anomaly, then the court has to give an opinion for abortion.
So it's not mandatory to continue the pregnancy. Depends upon the consent.
It is right of the girl, ma'am.
Okay. Ma'am, one
So
more
as per the
question.
Juvenile Act, she will be, I mean, she can take a call whether she wants to continue the pregnancy or she can go for an abortion. And after the delivery, like after the abortion also, if the child is live, even if she wants to have that child, she can have it. But after the 6 months, that complete explanation is given in the SOP. So
Madam,
what child protection?
Chandrika
Sir.
madam, I'll come in between. Sir's
sir.
question is, nowadays they are booking case against doctors who are not informing this below 18 years girl conceiving, and they are coming for treatment and they are getting delivered or aborted. And if the doctor or a sonologist, if not informed to the authority, they are going to be punished and they are booked. And some of the doctors are arrested. Recently, we have seen many cases. So recently
sir.
in Gulbarga, so ಅದಕ್ಕೆ ಅವರು ಸರ್ ಕ್ಲಾರಿಫಿಕೇಶನ್ ಇದಕ್ಕೆ ಕೇಳ್ತಾ ಇದಾರೆ. ಏನ್ ಮಾಡ್ಬೇಕು, ನನ್ನ ಹತ್ರ ಡಾಕ್ಟರ್ ಹತ್ರ ಬಂದ್ರೆ ಟೀನೇಜ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಯಾವ್ದೇ ಬಂದ್ರು ಇನ್ಫಾರ್ಮ್ ಮಾಡ್ಬೇಕು ಅಪ್ರಾಪ್ರಿಯೇಟ್ ಅಥಾರಿಟಿಗೆ ಅಂತ ಅವ್ರಿಗೆ ಹೇಳ್ಬೇಕು ಮೇಡಮ್. ಅದು ಅದನ್ನ ಅವರು he was expecting that answer from me. ಅಲ್ವಾ ಸರ್?
Is that sir? Okay.
Sir, RP sir.
For any case, sir.
Yes, sir. Your question is correct. Yes, sir.
Yes, sir. Sorry, I took it another way. Sorry. Sir, for any case below 18 years, it comes under POCSO case. The information has to be given to the police, sir. Maybe the case FIR is not being booked by the doctor. The information has to be given to the police and to the child protection officer. ಅಷ್ಟೇ ಸರ್. ಅದು 1098 ಏನ್ ನಂಬರ್ ಇದೆ ಅವ್ರಿಗೆ ಒಂದು ಕಾಲ್ ಮಾಡಿ ಇನ್ಫಾರ್ಮ್ ಮಾಡಬೇಕು ಸರ್. ಅಂಡ್ ಅಡ್ರೆಸ್ ಡೀಟೇಲ್ಸ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಟೇಕನ್ ಪ್ರಾಪರ್ಲಿ ಸರ್. ಇದು ತಕೊಂಡು ಅವ್ರಿಗೆ ಇನ್ಫಾರ್ಮೇಶನ್ ಕೊಡೋದಷ್ಟೇ ನಮ್ ಜವಾಬ್ದಾರಿ ಸರ್. ಅಂಡ್ ಅದನ್ನೇ SOP ನಲ್ಲಿ ಹೇಳಿದೀವಿ ಸರ್. ಇಮಿಡಿಯೇಟ್ಲಿ ಪೊಲೀಸ್ ಹ್ಯಾಸ್ ಟು ಆಕ್ಟ್ ಅಂಡ್ ಚೈಲ್ಡ್ ಪ್ರೊಟೆಕ್ಷನ್ ಆಫೀಸರ್ ಹ್ಯಾಸ್ ಟು ಕಮ್ ಇನ್ ಬಿಟ್ವೀನ್ and they have to take care of the child. Other services, ANC services, abortion services will be provided by the health department, sir.
Madam, one more line. There is a lot of harassment to the doctors by the police in such a cases. So what the experts say is, please send it by email, so that police cannot say that we have not received this thing, or you have informed the wrong police station, etc., etc. Thank you, madam.
Sir, thank you, sir.
Madam, ಇನ್ನೊಂದು
sir, ಇಲ್ಲಿ
ಇತ್ತೀಚೆಗೆ ನನಗೆ ಒಬ್ರು ಮೆಡಿಕಲ್ ಆಫೀಸರ್ಗ ಬಹಳ ಒದ್ದಾಡಿದ್ರು. ಏನಾಯ್ತು, ಅಲ್ಲಿ ಒಂದು ಬಂದಿದೆ, ಅವ್ರು ಆ ಊರ್ದು ಅಲ್ಲ ಹುಡುಗಿ, ಬೇರೆ ಏನೋ ಕೂಲಿ ಕೆಲ್ಸಕ್ಕೆ ಬಂದಿದ್ದಂತವ್ರು. ಸೊ ಅದು ಬಂತಲ್ಲ, ಇದಕ್ಕೆ ತೋರ್ಸ್ಕೊಳ್ಳಕ್ಕೆ ಅಂತ ಬಂದ್ರು. ಅವ್ ಪ್ರೆಗ್ನೆಂಟ್ ಅಂತ ಗೊತ್ತಾಯ್ತು. ಅಡ್ವಾನ್ಸ್ಡ್, ಇಟ್ ಈಸ್ ಆಲ್ಮೋಸ್ಟ್ ಸೆಕೆಂಡ್ ಟ್ರೈಮಿಸ್ಟರ್. ಅವಾಗ ಅವರು ಇಂಟಿಮೇಟ್ ಮಾಡಿದ್ರು, ಪೊಲೀಸ್ಗೆ ತಿಳಿಸಿದ್ರು, ಮತ್ತೆ CDPOಗೂ ತಿಳಿಸಿದ್ರು. ಬಟ್ ಏನ್ ಹೇಳ್ತಾರೆ ಅಂದ್ರೆ, ಆ ಪೊಲೀಸರು ನೀವೇ ಬಂದು FIR ಮಾಡಿಸ್ಬೇಕು, ನೀವೇ ಕಂಪ್ಲೇಂಟ್ ಕೊಡ್ಬೇಕು, ನೀವೇ ಅವ್ರನ್ನ ಆ ಪಾರ್ಟಿನ ಹುಡುಕೊಡ್ಬೇಕು, ಹಾಗೆ ಹೀಗೆ ಅಂತ ತುಂಬಾ ಹರಾಸ್ ಮಾಡಿ 3 ದಿವಸ ಅವ್ರ ಡಾಕ್ಟರ್ನ ಅಡ್ಡಾಡ್ಸಿದ್ದಾರೆ ಪೊಲೀಸರು. ಸೊ ಅದಕ್ಕೆ ವಾಟ್ ಇಸ್ ಯುವರ್ ಒಪಿನಿಯನ್ ಆನ್ ದಿಸ್? ಯಾಕಂದ್ರೆ ಪೊಲೀಸರು ಹರಾಸ್ಮೆಂಟ್ ಮಾಡ್ತಿದ್ದಾರೆ. ಅಲ್ಲ, ಪೊಲೀಸರು ತುಂಬಾನೇ ಹರಾಸ್ ಮಾಡ್ತಿದ್ದಾರೆ. ಅದಕ್ಕೆ ಪೊಲೀಸರಿಂದ ಹರಾಸ್ಮೆಂಟ್ ತಪ್ಪಿಸ್ಕೊಳಕ್ ಏನ್ ಮಾಡ್ಬೇಕು ಅಂತ ಈ ಒಂದು ವೇದಿಕೆ ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡ್ತೀನಿ ನಿಮ್ಮಿಂದ.
ಸರ್ ಖಂಡಿತ, ಅದಕ್ಕೇನೆ ನಾವು SOP ನಲ್ಲಿ ಕ್ಲಿಯರ್ ಆಗಿ ಹೇಳಿದೀವಿ ಸರ್, ಯಾರ್ಯಾರ್ದು ಏನೇನ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಅಂತ. ವಾಟ್ ಈಸ್ ದ ಮೆಡಿಕಲ್ ಆಫೀಸರ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಅನ್ನೋದನ್ನು ಹೇಳಿದೆ. ಅಂಡ್ ಓನ್ಲಿ ಇನ್ಫಾರ್ಮೇಶನ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಶೇರ್ಡ್ ವಿತ್ ಅ ಚೈಲ್ಡ್ ಪ್ರೊಟೆಕ್ಷನ್ ಆಫೀಸರ್ ಅಟ್ WCD ಅಲ್ಲಿ ಒಬ್ರು ಏನಿದೆ WCD ಗೆ ಒಂದು ಇನ್ಫಾರ್ಮೇಶನ್, ಯು ಕ್ಯಾನ್ ಜಸ್ಟ್ ಗಿವ್ ಅ ಫೋನ್ ಕಾಲ್ ಟು ದ ಪೊಲೀಸ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಅಂಡ್ ಸೇ ಅಷ್ಟೇ. ಯಾರಿಗೂ ಇಲ್ಲಿ ಡಾಕ್ಟರು ಯಾಕೆ ಅದನ್ನ ರಿಪೋರ್ಟ್ ಮಾಡಿಲ್ಲ, ಪೊಲೀಸ್ಗೆ ಕಂಪ್ಲೇಂಟ್ ಯಾಕೆ ಕೊಟ್ಟಿಲ್ಲ ಅಂತ ಯಾರು ಕೇಳೋದಿಲ್ಲ. ಬಟ್ ದ ಚೈಲ್ಡ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಟ್ರ್ಯಾಕ್ಡ್. ನೀವು ಇನ್ಫಾರ್ಮೇಶನ್ ಕೊಡಿ, ಲೇಟ್ ಆಗಿ ಕೊಡ್ತೀರಾ, ಅದು ಮಾಡ್ತೀರಾ, ಏನೂ ಇಲ್ಲ ಇದರಲ್ಲಿ. ಒಟ್ಟಲ್ಲಿ
ನನ್ಗನ್ಸುತ್ತೆ ಅದು SOP ರೀರೈಟ್ ಮಾಡೋದ್ ಬೆಟರ್ ಅನ್ಸುತ್ತೆ ಮೇಡಮ್. ಯಾಕೆಂದ್ರೆ ಅದು ಕ್ಲಿಯರ್ ಕಟ್ ಆಗಿಲ್ಲ. ಪೊಲೀಸ್ ಇಂಟಿಮೇಶನ್ ಕೊಡ್ಬೇಕು ಅಂತ ಇದೆ, ಆ ಪೊಲೀಸರು ಏನಂತಾರೆ, ಅವ್ರು ಅದನ್ನ ಅರ್ಥ ಮಾಡ್ಕೋತಾ ಇಲ್ಲ. ಅವರು ನಾವೇ ಹೋಗಿ ಕಂಪ್ಲೇಂಟ್ ಕೊಡ್ಬೇಕು ಅಂತ ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡ್ತಾರೆ. ಸೊ ಅದಕ್ಕೆ ಇದು ಅದೇ ಶುಡ್ ಬಿ ಕ್ಲಾರಿಟಿ. ಮೆಡಿಕಲ್ ಆಫೀಸರ್ ರೋಲ್ ಜಸ್ಟ್ ಇನ್ಫಾರ್ಮ್ ಮಾಡಿದ್ರೆ ಅಷ್ಟೇ ಮುಗೀತದೆ. ಅದು ಮೆಡಿಕಲ್ ಆಫೀಸರ್ ಆರ್ ಎನಿ ಡಾಕ್ಟರ್ ಫಾರ್ ದಟ್ ಮ್ಯಾಟರ್ ಹೂ ಇಸ್ ಲುಕಿಂಗ್ ಆಫ್ಟರ್ ದಟ್.
ಸರ್ ಹೌದು, ನಾವು ಇದನ್ನೆಲ್ಲ ಡಿಸ್ಕಷನ್ ಮಾಡಿದ್ದೇವೆ ಸರ್. ಸರ್ ಇಲ್ಲಿ ಏನಾಗ್ತದೆ ಅಂತ ಹೇಳಿದ್ರೆ, ಮೆಡಿಕಲ್ ಆಫೀಸರ್
ಇವಾಗ ಅವರು ಚೈಲ್ಡ್ ಪ್ರೊಟೆಕ್ಷನ್
ಕೇಳ್ತಾ
ಆಫೀಸರ್ಸ್
ಇದ್ದಾರೆ ಅಂದ್ರೆ,
ಅಲ್ಲ, ಇನ್ನೊಂದು ವಿಷಯ,
ಹೌದು ಸರ್.
ಚೈಲ್ಡ್ ಪ್ರೊಟೆಕ್ಷನ್ ಆಫೀಸರ್ಸ್ ಎಸ್ಕೇಪ್ ಆಗ್ತಾ ಇದ್ದಾರೆ ಇದರಿಂದ.
ಓಕೆ,
ಸೊ ಅವರು ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ತಗೋತಾ ಇಲ್ಲ. ಯಾರು ಫಸ್ಟ್ ನೋಡಿದಾರೋ ಡಾಕ್ಟ್ರು, ಆ ಡಾಕ್ಟರ್ ಫಿಕ್ಸ್ ಮಾಡೋದಕ್ಕೆ ಈ ಚೈಲ್ಡ್ ಪ್ರೊಟೆಕ್ಷನ್ ಆಫೀಸರು ಟ್ರೈ ಮಾಡ್ತಾ ಇದ್ದಾರೆ, ಮತ್ತೆ ಪೊಲೀಸರು ಟ್ರೈ ಮಾಡ್ತಿದ್ದಾರೆ. ಅದಕ್ಕೆ ವಿ ಹ್ಯಾವ್ ಟು ಎಜುಕೇಟ್ ಬೋತ್ ಚೈಲ್ಡ್ ಪ್ರೊಟೆಕ್ಷನ್ ಆಫೀಸರ್ಸ್ ಆಸ್ ವೆಲ್ ಆಸ್ ಪೊಲೀಸ್. ಇಲ್ಲ ಅಂತಂದ್ರೆ ಈ ಹರಾಸ್ಮೆಂಟ್ ಇಲ್ಲದೇ ಇಲ್ಲ ಮೇಡಮ್. ದಟ್ ಈಸ್ ಮೈ ಅಬ್ಸರ್ವೇಶನ್, ಐ ಆಮ್ ಟೆಲ್ಲಿಂಗ್ ಯು. ಯಾಕಂದ್ರೆ ಐ ಟ್ರಾವೆಲ್ ಅಕ್ರಾಸ್ ದ ಸ್ಟೇಟ್, ಐ ಆಮ್ ಟೇಕಿಂಗ್ ಒಪಿನಿಯನ್ ಫ್ರಮ್ ಡಾಕ್ಟರ್ಸ್. ತುಂಬಾ ಜನಕ್ಕೆ ತುಂಬಾ ಹರಾಸ್ಮೆಂಟ್ ಆಗಿದೆ ನಮ್ಮ. ಅದಕ್ಕೋಸ್ಕರ ಮೈ ರಿಕ್ವೆಸ್ಟ್ ಟು ಯು, ಪ್ಲೀಸ್ ರೀರೈಟ್ ದಿ SOP and educate both the police as well as child protection officers.
Sir, I will show you the SOP which has revised it. Probably ನೀವು ಯಾವ್ದನ್ನ ನೋಡಿದೀರಾ ಸರ್? ರೀಸೆಂಟ್ ಆಗಿ ನಾವು ರಿವೈಸ್ ಮಾಡಿ ಕಳ್ಸಿರೋದನ್ನ ನೋಡಿದೀರಾ ಸರ್?
ಮೇಡಮ್ ಹಾಗಲ್ಲ. ಪ್ರಾಕ್ಟಿಕಲಿ ಏನಾಗುತ್ತೆ, ಒನ್ ಡಾಕ್ಟರ್ ವಾಸ್ ಇನ್ ಜೈಲ್, 70 years old gynecologist, because she reported to the police station, one police station, and from the other police station people came and arrested her. That is why we advise the doctor to send it by email so that it cannot be refused. That is one part. Secondly, there is so much, we cannot ask the patient, that is the child, to stay here. It is not our responsibility to keep her until the police come, or the police to take her to police station and all. It cannot be done. You see, we have to just inform that we have seen as a patient like that. We are not the investigating officer, or we cannot restrain the patient against her will. There is some ambiguity, madam. The police take the advantage of it.
I understood, sir. Definitely. We will take it up, sir. ನಾನು ವೀರಭದ್ರಯ್ಯ ಸರ್ ಗಮನಕ್ಕೆ ತಕೊಂಡ್ ಬಂದು ಪ್ರಾಬ್ಲಿ ಅದನ್ನ if I don't know, because we have discussed and we have written it. As you tell, like only one email has to be sent. If that point can be included, and if it is included, then that will sort out our problem. And definitely I will include that point, sir. As still it is not yet notified, I will add that point. ಒಂದು ಇಮೇಲ್ ಅನ್ನ ಕೊಡ್ಬೇಕು ಅಷ್ಟೇ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು, ಅಂಡ್ ಲೇಟರ್ ಆನ್ ಇಟ್ ಇಸ್ ಅ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಆಫ್ ದ ಪೊಲೀಸ್ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು, ಸೊ ವಿಲ್ ಮೇಕ್ ದಟ್ ಪಾಯಿಂಟ್. ಸರ್ ನಾಳೆ ನಾನು ನಿಮ್ ಹತ್ರ ಐ ವಿಲ್ ಡಿಸ್ಕಸ್ ವಿತ್ ಯು ಸರ್, ವೀರಭದ್ರಯ್ಯ ಸರ್. ಸರ್ ಅದು, ಅಂಡ್ ವಿ ಹ್ಯಾವ್ ಆಲ್ಸೋ ಕೆಪ್ಟ್ ಇನ್ ದಟ್ SOP orientation to the police department and to the WCD department, child protection department, and the forensic department. ಈಗ ಇನ್ನು ಮಕ್ಕಳುಗಳು, ನಿಮ್ಗೆ ಇದು ಒಂದು ಪಾರ್ಟ್ ಆಯ್ತು ಅಂತ ಹೇಳಿದ್ರೆ, ಅಬಾರ್ಷನ್ ಮಾಡಿಸ್ಕೊಂಡು ಮಕ್ಕಳು ಬದುಕಿರುವಂತವು ಅವನ್ನ ಅಡಾಪ್ಟು ಮಾಡ್ಕೊಳಕ್ಕಾಗ್ದೇನೆ, ಅಂಡ್ ಯಾವುದೋ ಒಂದು NGOs ರನ್ನಿಂಗ್ ಮಕ್ಕಳದ್ದು ಕೇರ್ ಸೆಂಟರ್ಗಳಲ್ಲಿ ಇನ್ನೂ ಮಕ್ಕಳುಗಳು ಇರುವಂತದ್ದನ್ನ ನಾವು ನೋಡ್ತಾ ಇದ್ದೀವಿ. 1 ವರ್ಷ 2 ವರ್ಷದಿಂದ ಕೂಡ ಆ ಮಕ್ಕಳು ಅಲ್ಲೇ ಇರುವಂತದ್ದನ್ನ. ಸೊ ಅವಕ್ಕೂ ನಾವು I mean, as early as possible, DNA testing ಆಗ್ಬೇಕು, and ಆ DNA testing ಆಗ್ತಿದೆ ಹಂಗೇನೆ ಅದು adoption ಗೆ ಅದು ಹೋಗ್ಬೇಕು. ಅದನ್ನು ಕೂಡ process ಅನ್ನ fasten ಮಾಡ್ಲಿಕ್ಕೆ ಕೂಡ we are following up, sir. Maybe ಇದು email ಒಂದು ಹಾಕೋದ್ರಿಂದ if the issues will be solved ಅಂತಂದ್ರೆ we'll have a discussion tomorrow, sir. ಅದು ತಗೊಂಡ್ಬರ್ತೀನಿ. Before we notify it, we can definitely add that point if it is required. ಯಾಕಂದ್ರೆ ನಾವು ಸುಮಾರು ಎಲ್ಲದನ್ನು ಹೇಳಿದ್ದೇವೆ ನಾವು ಅದರಲ್ಲಿ. ಸ್ಟಿಲ್ ಯಾಕಂದ್ರೆ ಪೊಲೀಸ್ ಅವರು
ಕಮಿಷನರ್ ಸರ್ ಇಂಟರ್ವೆನ್ಷನ್ ಬೇಕು ಅಂದ್ರೆ ಇಂಟರ್ವೆನ್ಷನ್ ಬೇಕು ಅಂದ್ರೆ ಅವ್ರ ಹತ್ರನು ಮಾತಾಡೋಣ ಮೇಡಮ್ ಬೇಕಿದ್ರೆ. ಯಾಕಂದ್ರೆ ಸುಮ್ನೆ ಹರಾಸ್ಮೆಂಟ್ ಆಗ್ಬಾರ್ದು ಡಾಕ್ಟರ್ಸ್ಗೆ, ಅದಕ್ಕೋಸ್ಕರ.
ಬಟ್ ಇನ್ನೊಂದು
ಅವ್ರದ್ದೇನು ತಪ್ಪಿರಲ್ಲ ಮೇಡಮ್, ಅವ್ರು ಯಾರೋ ಟ್ರೀಟ್ಮೆಂಟ್ ಬರ್ತಾರೆ ನೋಡಿರ್ತಾರೆ. ಈಗ ನಿಮ್ಗೆ ಗೊತ್ತು, ಮಂಡ್ಯದಲ್ಲಿ ಇಬ್ರು ಸೋನಾಲಜಿಸ್ಟ್ ನ ಅರೆಸ್ಟ್ ಮಾಡಿದ್ರು ಜಸ್ಟ್ ಬಿಕಾಸ್ ದೇ ಹ್ಯಾವ್ ನಾಟ್ ಇನ್ಫಾರ್ಮ್ಡ್ ದ ಕೇಸ್. ಆಮೇಲೆ ನಿನ್ನೆ ಒಂದು ಪೇಪರ್ ಅಲ್ಲಿ ಓದ್ದೆ, 3 ಜನ ಡಾಕ್ಟರ್ಸ್ಗೆ ಅರೆಸ್ಟ್ ಮಾಡಿದ್ದಾರೆ. 3 ಜನ ಡಾಕ್ಟರ್ಸ್ಗೆ ಇನ್ಫಾರ್ಮ್ ಮಾಡಿಲ್ಲ ಅನ್ನೋ ಉದ್ದೇಶಕ್ಕೆ.
Dr. Anuradha sir, madam, the practical difficulty is the SOP for the police is very important here, because they don't know the do's and don'ts properly. They blindly harass not only doctor, patient also. So ನಮ್ಗಳಿಗೆ ತುಂಬಾ ಕಷ್ಟ ಆಗ್ತಾ ಇದೆ ಮೇಡಮ್. ಆಮೇಲೆ ರಾಜೇಂದ್ರ ಪ್ರಸಾದ್ ಸಜೆಸ್ಟ್ ಮಾಡ್ದಂಗೆ ಒಂದ್ ಮೇಲ್ ಕಳ್ಸ್ಬಿಟ್ಟು ಬಿಟ್ಬಿಡಿ ಅಂತ ಹೇಳ್ತಾರೆ. ಬಟ್ ಹರಾಸ್ಮೆಂಟ್ ವೈಸ್ ಪೊಲೀಸ್ ಆರ್ ದ ಒನ್ಸ್ ಹೂ ಆರ್ least informed. They don't know anything. All that they know is they will harass the doctor who has informed as well as the patient. ಆ ಹುಡುಗನ ಅರೆಸ್ಟ್ ಮಾಡೋದು, ಆ ಪೇಷಂಟ್ಗೆ. So if you ask me, what I feel is, ಇನ್ಫಾರ್ಮೇಶನ್ ಕೊಟ್ಟ ಮೇಲೆ ನಾವು ಪೇಷಂಟ್ಗೆ ನಮ್ಮ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಅನ್ನ ಮುಂದುವರಿಸೋದು. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಶಿ ಕಮ್ಸ್ at term delivery in labor. All that we have to do is just send an email and continue to deliver the patient and let them come and take over. But that is not happening here. So ನಮ್ಗೆ treating doctors ಗೆ, gynecologist ಗೆ police SOP ನಾವೇ ಒಂದು ಕಾಪಿ ನಮಗೆ ಒಂದು ಕೊಟ್ಬಿಡಿ ಮೇಡಮ್, ಸೊ ದಟ್ ನಾವು ಆ ಕಾಪಿ ತೋರಿಸ್ಬಿಟ್ಟು ಆ ಕಾಪಿನ ನಾವು ನಮ್ಮ ಸೊಸೈಟಿನಲ್ಲಿ ಎಲ್ರಿಗೂ ಕೊಟ್ಬಿಡ್ತೀವಿ. ನನ್ನ ರೋಲ್ ಏನು, ಪೊಲೀಸ್
understood. So we'll draft it. I mean, maybe if required, we will change it, and I'll have a discussion with Veerbhadraya sir, and maybe if Commissioner sir intervention is required, then we will bring him.
Small submission,
and yes sir.
Ma'am, that SOP should be signed by the Commissioner of Health and Family Welfare and Police Department Commissioner. All 3 commissioners should sign that. Then it will be circulated in all those departments. So it will be familiar to them in that case.
Yeah. Different departments are there, so that will be signed by different department heads.
Thank you.
So that we will take care.
Sure. Thank you so much, ma'am, for the support.
Thank you very much, ma'am.
Last question. Teenage pregnancy at the age of 16 and 17 years coming for the ultrasound examination at 28 to 30 weeks of gestation with TAI card, when we inform 1098 at this stage. I think it's similar to the question of what Dr. Rajendra Prasad had asked, ma'am.
Alla madam, excuse me. Madam.
Please go ahead.
Ma'am.
ಅವರು ತಾಯಿ ಕಾರ್ಡ್ ಕೊಡಕ ಮುಂಚೆ ಟೀನೇಜ್ ಇರೋದನ್ನ ಆಶಾ ವರ್ಕರ್ಸ್ ಹ್ಯಾಸ್ ಟು ಕನ್ಫರ್ಮ್ ಅಂಡ್ ಟೆಲ್ ಟು ದ ಡಿಪಾರ್ಟ್ಮೆಂಟ್. ಬಟ್ ಏನಾಗುತ್ತೆ, ಅವ್ರು 28 ವೀಕ್ಸ್, 30 ವೀಕ್ಸ್, 34 ವೀಕ್ಸ್ ದೇ ಕಮ್ ಫಾರ್ ಸ್ಕ್ಯಾನ್. ಇದನ್ನು ಮೊದಲ ಅರ್ಲಿ ಇದ್ರಾಗ ಮಾಡಿದ್ರೆ, ಇಫ್ ದೇ ಡೋಂಟ್ ವಾಂಟ್ ದೇ ಕ್ಯಾನ್ ಗೆಟ್ ಟರ್ಮಿನೇಟೆಡ್ ಎಟ್ ದರ್ ಕನ್ಸರ್ನ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ಸ್ ಆಲ್ಸೋ. ಅಂಡ್ ಇಫ್ ವಿ ಇನ್ಫಾರ್ಮ್ 1098 at 36 weeks and all, it is not going to help. They compromise, get married, and they say we are married, they are coming and harassing us. We have seen so many people telling like that. So ASHA workers need training, madam, to report early, so that if they want termination, this teenage pregnancy can be terminated.
Yes, ma'am, it is there.
You have to educate ASHA workers.
Incentivized also. We have incentivized ASHA for this, for early identification and getting them for abortion services and all.
In the Aadhaar card also, madam. 16 years, they will make it 20 in Aadhaar card and bring. Patient will be 16.
I feel we can have one more session regarding this. So maybe after discussing and finalizing the SOP, I mean, if any correction is required, so then maybe we can have a one more session regarding.
Yeah,
Best
madam, it should be done
from
at
all of you.
base level only, so that they cannot continue to so much of.
Yeah. We will keep one more session regarding
And
discussion
what
regarding
we
this.
can
ma'am.
do is that
You
And,
should
you
inform
send us
ASHA
the-
workers strictly. Yeah.
Ma'am, Chinivalar ma'am. So, ma'am, Dr. Chandrika ma'am, what we can do? What are the suggestions or the points to be noted if they just send to us? So, we will send it to Dr. Veerbhadraya sir. Through him, you can communicate, ma'am. I think
definitely, ma'am, definitely.
that will be better.
And thank you very much, ma'am. Thank you, Veerbhadraya
much,
sir,
ma'am.
and thank you all others.
Any other questions from the audience? Dr. Neelama, Dr. Anuradha ma'am.
Ma'am, if you
Many
have
senior
my number,
doctors are
please
there, ma'am.
share my number. They can let them put their queries to my WhatsApp, ma'am, so
Okay, ma'am,
that even I can include that if it is possible to include it in SOP, or if any circular or order can
Will I
be
put
passed
in the
from the
message box, ma'am, your
department.
number?
Madam,
Yes,
your
ma'am. Shall we
email
call,
as well as office email, personal email, and your phone number, madam.
Yeah, I'll share, ma'am. I'll share to Padma madam so that she can share to everybody.
Okay.
Yes.
Thank you, ma'am.
She will put it in
Thank
the
you.
group.
Sure, ma'am.
Yes, ma'am. Thank you. Thank you very much, ma'am.
Thank you so much, ma'am. I think any
Thank
other
you.
questions from the audience? I think we are come to the end of the session. Very wonderful session, very interesting and very informative also, especially whatever doctors are busy practitioners when it comes to handling police department or judiciary. I think they'll be a bit like that, take one step back, ma'am. So thank you so much for a very informative session, and even I thank Dr. Veerbhadraya sir also for joining. He was saying 9 o'clock is a little late hours, but this is a plan which was done by the ladies wing MKSP sir, because after practice once they come
Dr.
home.
Padma, sorry to interfere.
Tell me, ma'am.
Sorry to interrupt, Padma.
Heli, ma'am.
Well, the main message of this particular session, Padma and Dr. Chandrika, the main intention of this session was about population control, and I think the onus is each one, is on each one of us, particularly our pediatricians taking care of adolescents, as well as we gynecologists and all doctors taking care of our patients. We will have to keep for at least 5 minutes to talk about contraception. I think, madam, that is the main message. And the second corollary is the practical difficulties we are facing because of treating or examining or a teenage pregnancy. Thank you, Padma.
I agree with you, ma'am. I think we'll come to the end of the session. Thank you so much, ma'am. And now, vote of thanks by Dr. Jessie. Over to you. Dr. Jessie?
ನೀವೇ ಮಾಡ್ಬಿಡಿ ಮೇಡಮ್.
ನಾ ಮಾಡ್ತೀನಿ.
ಮಾಡ್ರಿ. ಸಾರಿ, ಡಾಕ್ಟರ್ ಚಿನ್ನಿವಲ್ಲರ್ ಮ್ಯಾಮ್, ಪ್ಲೀಸ್.
ಇಂದಿನ ವಿಶ್ವ ಜನಸಂಖ್ಯಾ ದಿನದ ಅಂಗವಾಗಿ ಹಮ್ಮಿಕೊಂಡಿರುವ ಆನ್ಲೈನ್ ಕಾರ್ಯಕ್ರಮದ ಕೇಂದ್ರ ಬಿಂದು ಡಾಕ್ಟರ್ ಚಂದ್ರಿಕಾ BR, ಡೆಪ್ಯೂಟಿ ಡೈರೆಕ್ಟರ್ ಆರೋಗ್ಯ ಮತ್ತು ಕುಟುಂಬ ಕಲ್ಯಾಣ ಇಲಾಖೆ, ಕರ್ನಾಟಕ ಸರ್ಕಾರ ಇವರು ತಮ್ಮ ಅನುಭವದ ನುಡಿಗಳಿಂದ ಸವಿಸ್ತಾರವಾಗಿ ನಮ್ಮ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಸದಸ್ಯರಿಗೆ ಮನವರಿಕೆ ಮಾಡಿಕೊಟ್ಟಿದ್ದಾರೆ. ನಾವು ಅನುಭವಿಸ್ತಿರುವ ಕೆಲವು ಪ್ರಾಕ್ಟಿಕಲ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಕೂಡ ಅವರು ಈ ಒಂದು ವೇದಿಕೆಯಿಂದ ನಮಗೆ ಸೊಲ್ಯೂಷನ್ಸ್ ಕೊಡ್ತಾರೆ ಅಂತ ನಾನು ಭರವಸೆ ಇಟ್ಟಿದ್ದೇನೆ. ತಮ್ಮ ಬಿಡುವಿಲ್ಲದ ಕೆಲಸದ ಮಧ್ಯೆ ನಮ್ಮ ಕರೆಗೆ ಹೋಗುಟ್ಟು ಸಕ್ರಿಯವಾಗಿ ಭಾಗವಹಿಸಿದ್ದಕ್ಕೆ ನಮ್ಮ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಶಾಖೆ ಮತ್ತು ಮಹಿಳಾ ಘಟಕ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪರವಾಗಿ ಹೃದಯಪೂರ್ವಕ ವಂದನೆಗಳು. ಇನ್ನು ನಮ್ಮ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ಕರ್ನಾಟಕ ಶಾಖೆಯ ಅಧ್ಯಕ್ಷರು ಡಾಕ್ಟರ್ ವೀರಭದ್ರಯ್ಯ ಸರ್ ಹಾಗೂ ಕಾರ್ಯದರ್ಶಿಗಳಾದ ಡಾಕ್ಟರ್ ಸೂರ್ಯರಾಜು ಸರ್ ಹಾಗೂ ಮಾಜಿ ಅಧ್ಯಕ್ಷರುಗಳು ಹಾಗೂ ಭಾಗವಹಿಸಿದ ಎಲ್ಲ ಪದಾಧಿಕಾರಿಗಳಿಗೆ ನಮ್ಮ ಮಹಿಳಾ ಘಟಕದ ಪರವಾಗಿ ಧನ್ಯವಾದಗಳು. ತಮ್ಮೆಲ್ಲರ ಸಹಕಾರ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ಫೂರ್ತಿ. ಇನ್ನು ಈ ಕಾರ್ಯಕ್ರಮದ ರೂವಾರಿ ಡಾಕ್ಟರ್ ಪದ್ಮಾ ಪ್ರಕಾಶ್ ಸದಾ ಚಟುವಟಿಕೆಯಿಂದ ನಮ್ಮನ್ನು ಕ್ರಿಯಾಶೀಲರಾಗುವಂತೆ ಮಾಡುವ ಚೇರ್ಮನ್, ಇವರಿಗೂ ನಮ್ಮ ಮಹಿಳಾ ಘಟಕದ ಪರವಾಗಿ ಅಭಿನಂದನೆಗಳು. ಇನ್ನು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಪಾಲ್ಗೊಂಡು ಯಶಸ್ವಿಗೊಳಿಸಿದ ವೈದ್ಯ ವೃಂದಕ್ಕೆ ಹೃದಯಪೂರ್ವಕ ಧನ್ಯವಾದಗಳು. ಜೈ ಹಿಂದ್, ಜೈ ಕರ್ನಾಟಕ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ಚಿರಾಯುವಾಗಲಿ.
Thank you so much, ma'am. We'll catch up on every second Tuesday at 9 p.m. from Ladies Wing MAKSP. Thanks everyone. Good night.
Thank you. ವಂದನೆಗಳು.
Good night.
Thank you, everyone.